about the current statistics that HIV infections are on the rise?
I'm not really a fan of statistics.
We're promoting promiscuity. There's no cure. It only makes sense that HIV and other sexually transmitted diseases would be on the rise.
Why? Because people are having unprotected sex. It's like, yeah, it's just living dangerous lifestyle.
I don't think the public is being told anything. You know, the media is just not telling us anything. I haven't read anything about it. This is the first time I've heard about it.
I see myself as a little bit of a seditious element, but that's only in relation to the fact that society as a whole is now pretty uncaring. And
did that make any sense? No. Well, what I meant was, isn't it fucking great to dress up?
I love the street culture and I like the boisterousness of Sydney. I like the fact that it's kind of cheap and leery, and I like the fact that there's an adequate population to make the place interesting. When did I first become HIV? I can't remember, because I think I was probably already infected for a couple of years before I found out. And I had some swollen lymph glands and night sweats and all the telltale signs kind of around 1990. So I remember walking from Burke Street, Darlinghurst to Burton Street, Darlinghurst, and I felt like one of those, either a blue-ringed octopus or a spotted shark. I actually felt like I was covered in these bright blue dots, and I thought that the whole world could tell that I was HIV positive and that they wouldn't want to touch me with a 10-foot pole.
You know, mental health is a big issue too, especially for glamorous people, you know.
Mental stuff was really hard to put your finger on. Anything from vagary to mood swings, you know, mild kind of, really mild sort of what I would imagine psychotic feelings. Protease inhibitors came in whenever that was, that I went on to, I was on AZT, 3TC, DDC, and no, ritonavir and saquinavir, and it was the ritonavir that really was disgusting. I used to burp up fumes. My mouth tasted like steel. That would happen about 2 to 3 hours after I took the tablets. And my whole body felt like I had a mild current going through it.
A lot of people were saying that the treatments for HIV are working, but also that some of the side effects of both HIV and the treatments is dementia and various forms of mental illness.
I was piss crystal, so that was really painful, and I lost all my body hair.
I'm still hallucinating from this virus, because I'm happy just to sit here all night and talk to myself.
There was a few other side effects with that as well. Anemia I was developing, we noticed in blood tests, and it was stressing the liver a little bit. So I said to my doctor, okay, I'm having a break.
I was diagnosed with HIV around 1984, 85. I'm not really sure of when the actual date is. It's been between 15, 17 years. I know, it's a long time. When I found out, I went to the clinic where I was living, and a friend of mine went down there with me. We both got tested. We called on the phone to get our results. He found out first he was negative, and I found out I was positive. I was devastated because I didn't think I was going to be positive. And I guess that's where my journey started.
Do you know anybody with HIV?
No.
Have you ever heard about the medicines, HIV medicines?
Yeah.
What do you know about those?
I don't know anything about those. I just know as much as the everyday Joe, I think.
I take a whole slew of drugs. I'm sure like everyone, a whole arsenal. I take a cocktail, a drug cocktail. I take Rescriptor, Varicept, and Hivit, I'm not sure. actually even how you say it. That is my HIV cocktail, basically, which gets all my counts going, my T-cell counts, my viral loads down, and it's doing its job. I've been taking them for 5 to 6 years now, this particular cocktail.
What about the side effects?
I haven't heard anything about that.
Have you heard anything about the side effects of the drugs?
I have, yeah, definitely.
What
Through
have you heard?
Friends. Skin problems.
I know the people that do take those medicines, they're not very happy taking an armada of medicines that have all kinds of impacts on their bodies and minds.
I take approximately 9 to 10 pills 3 times a day, so that's about 30 pills a day. They do have a lot of side effects other than just diarrhea, which is chronic, and you have headache, you have nausea, you just don't feel good. But I'm thinking about getting off, taking a break from my meds. I shouldn't do it. Because I was thinking just give myself like a 6-month break, give my liver a rest and all that, and
Well, the problem is, Todd, you're really taking a risk.
When you
Because, yes, and especially because you have taken multiple medications in the past.
right.
And so your alternatives may not be that good, you know what I'm saying? Lift your tongue up. So, and because your count is sort of marginal, when you get off medication, what'll happen is your viral load will go way, way, way high.
Right.
And then it'll drop your T-cell counts.
Right.
So that's my concern, is that if you get off of it and take a break, and I'm sure you'll feel a lot better when you get off the medication, but the problem is going to be that
Starting
it again.
True, because that's...
Take a deep breath in. Sorry.
Well, first they took me into this little room, and there's the box of Kleenex, and the guy's very, very, very serious. And he sits down, he flips through all the names and the numbers, and comes up to mine, and says, "Well, you've been HIV positive since your first blood draw for the hepatitis vaccine trial." So that was June 20th of 1979. I go to the gym regularly and do cardio workout and a weight workout. I don't take any medications for HIV, and I have never taken any medications. I absolutely believe that you have to have a good attitude, positive attitude. It's almost like you cross over this line and your life changes forever.
When would I tell a prospective partner that I was HIV positive? It's a good question. In Sydney, I'm very much out as a person and as a demi-celebrity. So a lot of people already know about my status. I'm kind of, I guess, quite well known as an HIV/AIDS activist.
Well, it's such a hard call. I mean, to me, it is truly, truly a dilemma.
Again, if there was someone who I really liked, I would tell them when I thought it was appropriate, and if that person responded in a negative way, then I'm better off without them, because that's essentially it. If someone's going to judge you for something as minor as a virus and give that more importance than you as a person, then you don't want them around.
You don't want to tell someone right away because you don't want to frighten them off, so you have to wonder, when am I going to lay this bomb on them?
Do I think I have passed the virus on to people? I don't think so, although a partner I have been with up until recently seroconverted during our relationship, probably 3/4 of the way into the relationship, and I can only assume that that was from myself, but I can't be sure of that. Any other situation, casual sex, didn't put myself in any situation where I would put anybody at risk, because what's the use?
Yeah, I do think that there is a good possibility that I could have infected people.
I don't think that I have given the virus to someone else, but then again, who knows?
I would feel sad if I had given it to somebody, but it was never anything that I would have done intentionally.
I don't think I've ever given anyone the virus. I would never want to give anyone this virus, you know.
There was a lot of time there where safe sex was not even in the vocabulary.
I don't know at this point, honestly, if I'm going to stop taking my medication, because, I mean, what the doctor said, I mean, there are a lot of truth to that.
I think I would be taking more of a risk to take the medications. For me, I think they would kill me.
And I've been off all treatments now for nearly 12 months, and I've never felt more energetic in all my life.
We only want just ordinary people. That's what our...
Oh, that counts me out, unfortunately. I'm extraordinary.
No, well, of course.
I'm not in a position to tell people what to do in their personal lives. I do know, though, that there is no cure at this time.
What do you think about the people that don't practice safe sex?
I think they're crazy.
Yeah, so it's just a question to me about safe sex, basically taking responsibility for yourself and making a choice. To me, it's as simple as that.